All right, welcome back to another edition of Nexus Connects Us. And today, Nexus connects us to Dr. Ellis to talk about the process with Nexus. Dr. Ellis, welcome. Thanks so much for being here on the show.
I appreciate you having me. I'm glad to join you guys today.
I see you got the Final Four. Is that the 2023 there?
Yeah, so I went to Virginia Tech, and my Hokies are one of two colleges in the nation that have never won a national title. Us in Kansas State. Actually, no, three. University of Central Florida. So my Lady Hokies actually made a Final Four a couple of years ago. So it's kind of one of our sad few proudest moments. We got within one quarter of actually winning a title back in 2000, but it's been a long road.
Yeah, when you got a sports team that has a drought, you got to celebrate what you can celebrate. So
exactly,
it's pretty awesome. Well, listen, let's talk a little bit about Nexus. First and foremost, how did you get into dentistry to begin with, and then let's talk a little bit how you got into sleep medicine.
Yeah, so I'm an orthodontist now. I've wanted to be an orthodontist since I was about 12 years old. Just had an amazing experience with my orthodontist when I was growing up, and it kind of sparked the bug early on. So I got the privilege of going to college and knowing what I wanted to do from a very, very early age. Which, now that I've had kids, I tell them all the time that college is tough, but it's a little bit easier when you got to focus.
When you know why and you know what you want to do, that makes sense.
Yeah. Exactly. Less time wasted. You know where you need to get. So dentistry has always been something I wanted to do, and orthodontics specifically. So, after going to Virginia Tech and then on to dental school and then on to my ortho residency, I came back to the Northern Virginia area and bought a practice and plopped down and been here for almost 19 years now, chugging away doing ortho. What kind of brought me into the sleep world was actually my own medical experience. About 15 years into my career, I started having, I've always been a bigger guy and I've always annoyed the heck out of my wife snoring away every single night. But for years, I just thought it was what it was. And, but I actually went down a pathway where I had some medical issues and started having some other stuff. And as I approached the medical world and started saying, why am I having all these problems? Their solution was just, here's a pill, here's a pill, here's a pill. And it wasn't fixing my problem. And so I ultimately ended up going to a continuing education program put on by a good friend of mine who was a prosthodontic dentist. And he had brought in a MD who was a sleep medicine specialist. And I felt like I was watching a video of my life. All the problems I was having were up on the screen. And I went and saw the gentleman the next morning. I got tested for sleep. It turned out I had sleep apnea. And once I started getting treated, all of a sudden I came off the pills. And so it became very apparent that this was an area that was not being looked at the time in the medical community like it really should be. And so then I started looking into it, and I started realizing that the appliances that were out there, the dental appliances, were orthodontic appliances that have been around and used by orthodontists for 80 years. And I'm like, what better thing to expand my knowledge base and give me another area of dentistry to get into than something that's very personal to me and is definitely in my wheelhouse as far as the appliances themselves. And so I went and worked with the Nexus team. At the time, they were Dream Sleep, and went through the certification process to not only just learn about it. Before I wanted to start treating patients, I wanted to educate myself. So they took me through the whole range of knowing absolutely nothing to certified with all of the continuing education to actually receive my certification in dental sleep medicine. And then I started down a pathway with the ACSDD to get board certified in this profession. And that's how I kind of got here.
So you've been doing dental for almost 20 years. Yeah. When did this happen though? This transition into the sleep medicine piece?
2017 was when I really started to kind of get interested in it. Yeah. And so it took me probably from 2017 till I would probably say 2019 to really, really get through the educational component. different docs have different ways. I'm a guy that likes to build my foundation before I start bringing patients into it. Some guys have no problem just jumping into the deep end and
Yeah.
learning as they go. And the thing is the cool thing about Nexus and the entire group is you can kind of enter this any way that you want. Yeah. But the great thing is I had a group that could not only get me what I needed, but get my team what I needed, get everybody what they needed to be able to understand how to treat this process effectively in a dental or orthodontic practice.
Yeah, that makes a lot of sense. And listen, it's a journey that I've been on myself, going from, being diagnosed, having to try to deal with this machine, and then working with the dentist, the older appliances that had like some bolts and
Yeah.
nuts and screws in there,
Yeah.
and I felt like I was going in to get a tune up, once a month, on through the newest device I have now that I got back in January. I mean, it took me from 37 events an hour to 0.
Yeah.
Sleep phenomenally. It's funny because I haven't credited my weight loss, but I have lost about 30 pounds so far this year.
Yeah.
I know part of the reason of that is because I'm sleeping way better than I was with a CPAP machine. And it's so much easier to work with a dentist and to have an appliance. I decided to take a couple of days off this week and do some riding, and I'm going to head up to the mountains with the dog and sleep in a tent, and I know I'm going to get a great night's sleep. It's a little plastic device I pop in my mouth. It's simple.
I'm about to say the reality is I firmly believe that CPAP still has a place in this world. I have a CPAP. I have an oral appliance. It's different things. It's finding what device works well for you and ultimately getting the results that you need. And so I still support patients that need CPAP and get them to their medical physicians. But I just keep finding more and more patients that just do so well with these oral appliances. The compliance rate is through the roof. And like you said, the technology just keeps getting better and better and better, and just making it easier for patients to be able to have access to this. So it's been fun watching the profession kind of develop over these last couple of years.
So let's next talk a little bit about why Nexus, because you've been around the Nexus system since the early days, even before it was called Nexus. And I can understand from a dentist's perspective, there's an education component, but let's be honest. When we're dealing with sleep medicine, we actually are going a little bit more towards the medicine side, at least from an insurance perspective, right? Because this is not here's my Delta Dental card. This is something that's a lot more medical, and there's a lot of aspects to that. How was the overcoming that in that process? Because you're transitioning a lot of senses from dental into a true medical practice in some
Yeah,
ways. How did
you
that
hit
work?
the nail on the head. Like dental insurance is easy. It's basically, here's my card, I've got certain benefits, and you got a cavity, you got this, you have that. You just do the dentistry, you make sure you collect the proper records, and you send it to them afterwards, and they pay you. It's dentistry is so easy from an insurance standpoint, but what we have found is the medical world, totally different game. And the thing is, the medical world is challenging even for medical physicians. The reality is the medical world doesn't necessarily want dentists in their world. And so making sure that you have the correct documentation to protect yourself, number one, to work through the process the way it needs to be, and to actually get paid, reimbursed, all that stuff. Like the reality is yes, we're all trying to help patients, but you have to be able to make money doing what you're doing in order to be able to pay for the service, keep the doors open, and be able to provide that care. And in the medical world, that's tough. So medicine, or at least insurance for medicine, it's more of gather information, go through pre-authorization, go through predetermination to make sure you get approval to do the stuff that you're going to do. And if you don't present it the right way to an insurance company, they're going to reject you. And that is the biggest thing that I have found in this world, is the barrier to care, which is crazy. Like, again, I went through some medical stuff that really, really messed up my life. And we're talking about stuff that shortens your life, degrades the quality of life, ends up increasing chances of stroke, heart attack, dementia, diabetes. Like, these are bad things. And yet the barrier to care is still money. And what patients basically come down to is, is, does my insurance cover this? And so what really, really opened doors for me and what Nexus really helped me with is eliminating that barrier to care. Being able
Mm,
to be an in-network provider with so many PPO-based insurance plans that I could have never gotten as just a dentist.
yeah,
The
sure.
medical, you have a very, very challenging time to call up a medical insurance and say, hi, I have a DDS. I would like to be in network with you. And they're like, that's great. Go back to med school, get an MD, and call us
Yeah,
when you. So it's interesting. You know, the thing that was great about Nexus is finding that bridge to be able to, you know, get away for a dentist to provide an appliance that only a dentist can provide. Like the
yeah.
MDs can't make the
Can't
dental
do that.
appliance, just like I can't give a person a CPAP,
Yeah,
and yet finding a way to be able to get reimbursed for it. And so that's
yeah.
been the breakthrough for me.
Absolutely, because you do want to get paid. I mean, in the end, I mean, you want to help people, but you can only do that for so long if you can't resource it properly.
Yeah.
So that does something. How about on the marketing side? I mean, is that you know, through your relationship with Nexus, are you out marketing on your own? Are you seeing lead gen that's coming through them? How does that all work?
So we've tried, you know, we've tried a number of different processes to be able to go through Nexus, and the folks at Dream Sleep have done a lot of phone calls and gotten the word out through social media and everything, and that definitely drove a chunk of patients when they're just
Yeah,
in the middle of the night, not sleeping,
yeah.
typing into their computer, how do
Oh,
I
yeah.
get this fixed? That definitely created some leads, and so yes, that was one source. But as of late, the biggest source is now that I've been doing it for a while, and these MDs are having patients go back to their office saying, hey, I got this appliance, I'm sleeping better, here are my test results showing that I'm treated. The docs are sitting there going, oh, wait a minute, there is somebody that does this, and oh, they'll communicate with us, and oh, they're doing it the right way. And the fact that the patients can say, and on top of it, they're in my insurance, like these docs, I'm now starting to get medical physicians, pulmonologists, cardiologists, and sleep physicians to actually send patients to us. And that is, you know, it's interesting. You know, we're all in the medical dental world, and to a certain degree, we're all fighting the same battle. But there is that separation between the MDs and the DDSs to kind of have that, like, let's work together to fix this problem.
Mm,
And it's getting better in the last 3 4 5 years. um, we've seen a lot more of the medical community kind of come around and say that these oral appliances actually have a place in this world. For a while, I would have ENTs just being like, you're wasting your time and energy. And
yeah.
you know, I had a patient that he was having 28 events per hour. We made him appliance. He went down to zero, and he actually went back to his ENT, who told him not to come to me and not to do it, and handed in the report and said, here, doc, you know, it does work. And so
Yeah.
it's kind of an interesting dynamic between the different communities, but it's getting better.
Yeah, that's incredible, and I think it is really important as a patient to talk to your doctor about this too. And it's funny because now that you say this, I mean, I've been doing this show for a year and a half for you guys. I don't think I've ever mentioned to my MD. She knows that. She's like, "Are you getting treatment for your apnea?" I'm like, "Yeah." I haven't really told her, right?
Yeah.
Which I need to do because you were right. That testimonial, and it's true. I mean, the doctors only really get the information that they get through, you know, their conferences, through reps that are coming by. But to hear from patients and to talk about how different their life is, that's a really big thing. I think there is an ideal situation where I have talked to some MDs that are like, look, the ideal situation is CPAP. Well, the ideal situation is getting people to actually comply. Let's
Yeah.
be honest with you, because if you can have a CPAP in every room of your house if you never use any of them. But that's the beautiful thing about the dental appliance, particularly the appliance that I have, this sort of 3D printed nylon. I'm shocked at how durable it is too. I've woken up in the middle of the night where I got it sideways in my mouth and I'm crunching on it, and just pop it back in and it works perfectly. And it's just so simple, right? It's just such an easy device to use versus the CPAP, making sure you have power, making sure you have water, cleaning the device, doing all these kind of things. The level of compliance is much higher. And I'm glad that you mentioned it, because the other piece I think that comes from this is just referrals from patients, because I just wrote down a name of somebody the other day I was talking to about this, and he was like, I need to get one of those. I'm like, okay, let me connect you with Brett and the team, because it really is important. I think when your life is better, because you sleep better, it really affects everything. It's not just, to your point about, the conditions that you had going into this. Those things go away when you start to sleep better.
No,
It-
it's a game changer. I can't tell you how many, disgruntled husbands show up in my office whose wives have said, "You're not coming back to the bedroom till you go see him." And they come in, we make them the appliance, and we see them, 2, 3 weeks later for that first check, and they come in, their skin looks better. They don't have bags. They look like they lost 10 years off their life, just getting younger
yeah.
from sleeping better. And they're just like, oh my God, like I can't believe. And the next thing you know, they're going to their poker night and they're sending their friends in. Like it is crazy what people just don't realize how much better their life can be if they would just address something. I talk to patients all the time, like if I put my hands around somebody's throat and lightly choke them, all right, think
Yeah.
about what your body response would be. Your heart rate would go up, you would get anxious, all these different things that happen. That's what you're doing when you are having sleep apnea all night. You are choking off your air supply, and you're doing it for 6, 7, 8 hours a night. Like, think about the degradation that can have on you. And something as simple as just putting an appliance in your mouth can resolve that stuff. And
Yeah.
it's amazing.
I think that, it becomes a much simpler patient conversation. It's a lot easier to have than having this idea of you're going to be chained to a CPAP for the rest of your life.
Yeah.
That's a hard conversation to have when you can say, look, that, the solution. And I see this a lot more and more, even when you watch television and you see, different medical conditions. I've noticed a lot of times, particularly recently now, that companies are starting to say, look, the treatment doesn't require surgery. It doesn't require all of this stuff, because that's the first thing we think about. I'm not getting that. I'm not dealing with that, because that's going to be a big deal. No, it's actually quite simple. It's quite simple to resolve these. And it has become a theme in medical advertising to say to people, look, there's an easier way here. And I think that's really what we do with Nexus is find an easier path.
Well, and I caution people because, what the appliances that we make, they're meant to not only treat the disorder, but also to, not mess up your teeth, not mess up your bite, and a lot of patients will basically say, well, I can just go get the over the counter version. And, the reality is we wouldn't do it yourself treat a cardiology problem or a liver problem. Like you need doctors in your world. You really, really
Hey, listen, there are kits on Amazon to do your own teeth. You can do your own fillings.
Fully aware.
I'm not sure that's a great idea.
Yeah.
I mean, listen, if we want to get even more simplistic, most of us don't cut our own hair, right? We have the tools to do it.
I know.
You need a perspective, you need an expertise, you need all of these things. And it's not that you could go buy some stupid thing on Amazon and try. That's not going to resolve the problem. And listen, the difference is too, to your point, like I went from 37 events an hour to 0.
Yeah.
It's like, could I have found some over the shelf thing that I boiled and did something? Yeah. And I might have went from 37 to 20 and I would have felt a little bit better. I did not solve the problem.
Exactly. No,
the measurement is where the solution is.
Yeah. Well, that's and like you said, there are lots of great appliances. Nexus's team, they don't introduce, like when I went through training, it was not, here's an appliance to be able to treat this. It is, here are 4, 5, 6, 7 different appliances that exist in the world, and this one's good for this reason, and this one's good for this reason, and they help educate me so that I can dial for my individual patient what is going to work for their potential, because nothing works for everybody.
Right.
You have to dial in that right one. And that's a very, very key component to having successful sleep treatment, is getting the right appliance for the right patient and going from there.
Yeah, the one size fits all thing does not totally work. Doesn't work when it comes to medicine. You got, especially when it comes to your mouth too. I've even noticed, look, I've had to take my device in if I had some dental work done, right? Because now we've got to adjust it a little bit and we've got to do a few things. So it does really require having a professional involved with you in the process and really being there for you. Talk a little bit for a minute about success stories you've seen with patients, because you've now, how many do you know how many devices you've done?
We've done a good chunk of devices at this point in time, and it's getting easier and easier, because I'm starting to get to the point where it's like, okay, this is the device that you need. And, you can just you start to see certain trends and everything, and so we're having an easier time getting patients dialed in and getting them to a happy place and everything. But to watch the effects that it's had on marriages and happiness, like that's one thing. To see the body changes, I've seen patients start getting treated, lose 30, 40 pounds afterwards. I've seen folks that look like they dialed 10 years off of their life. I've seen, my father got rid of his heart arrhythmia from doing it. Like, wow. It's powerful to watch all the cool things that happen with sleep, and especially the patients that have gone through CPAP, gotten frustrated, they were ready to give up, and then all of a sudden it's like, oh, there was another way. So that's been very rewarding. I get to straighten teeth and make beautiful smiles, and that's awesome, and I love doing it. But this is something that I really get to do that potentially changes people's lives, extends lives, and gives them a better quality of life when they get to the end of their life and they've worked, they've retired, and now they're trying to enjoy that life with their family, doing traveling and stuff like that. My father's appliance was made because they wanted to start going on cruises, and they needed to sleep in the same room and just needed a quiet setting. And so that's how he got started, and ended up having great medical benefits on the side. So it's been a very rewarding process. And the most frustrating thing at the beginning of doing sleep was I had all this knowledge and all this ability, but we couldn't get that past that financial barrier. It was not having the insurance. And when Nexus actually created a pathway like that, that was a game changer. It just was a total game changer as far as access to care.
Dr. Ellis, it's true. Even in the conversations I mentioned, I wrote down a name of somebody that I have to refer, and he was like, "What do the devices cost?" And I told him, and he was like, "It'd be worth it." And I'm like, "No. You have medical insurance?" He's like, "Yeah." I'm like, "You can get a company." He's like, "Wait, what?" I can't even. It's like, "Why didn't anybody mention this?"
I've had patients get things made for as little as, I had one guy that paid nothing out of pocket because he had amazing insurance. Some people, $100, again.
That's what mine was, $100. Yeah, it's like, why would I not do that?
Exactly.
Yeah, I mean, it's just such a great, and listen, I think also having a doctor that's partnered with you to make sure that this is the right solution for you is really important too. I was fortunate that in my process, I got Stan, I got all the top experts at Nexus helped me with and that's the reason I went from 37 to 0 first device right out of the gate, right? Because there were experts there. Yeah. It wasn't just, well, this is the product we sell, so you're going to have to try to make it work. Yeah. And this was really been great. How about tell folks, Dr. Ellis, where do you practice? And if people are in your area, how do they get a hold of you?
So I'm up in the Washington D.C. area, so outside of there in the suburbs in what's called Northern Virginia. I've got 4 practices in Annandale, Burke, Lorton, and Fairfax, Virginia. Our main office website is Virginia Orthodontic Partners, and so you can go to that website, and that'll get you hooked up with us and everything. But even on the Dream Sleep website and multiple other sites, we're listed there. So we're always helping in any way, shape, and form. Our goal every single year is to continue to keep helping Nexus in any way that we can, so that they can add further and further insurances. But like we have a lot of PPOs that we're able to work through, and it's been a fun process, and something that we very much enjoy doing.
I love it. Thank you so much for being here. Thank you all for joining us here on Nexus Connects Us. Until next time. In the human race, and we won't stop dreaming. No, we won't stop dreaming. We won't stop dreaming.